if you charge very, very low fees, your margins don't really allow you the budget to say, I'm going to redo the 2 or 3% that don't work out well. But if you look at that as a cost of business and say, okay, just like we buy insurance on lots of things, I'm sort of building an insurance factor into the service and saying, I know I may have to redo some of these. So I'm not going to charge rock bottom. I'm also going to allow myself to take more time and do the kind of work I would do for a friend or for family and do it for everybody. And then your failure rates go down even lower.
I think the words you used were, you're only as ethical as you can afford to be.
That's right. And so you need capital to be ethical.
To redo whatever you have to redo.
Yeah.
Because none of us are perfect.
Well, no, we were taught an imperfect profession by other imperfect people, and we practice on imperfect people. I realized if I cut my crown prep down from an hour and a half to an hour, I could mathematically prove to you that it's feasible to do more services and generate more revenue. But at one point along the way, halfway through my career, I came to a decision that my goal had to be 3 parts. That I wanted to drive home at the end of the day feeling that I was.
Welcome to the Authentic Dentist Podcast. Join Dr. Allison House of House Dental in Scottsdale and Sean Zayas, founder of Zana, as they lead dentists deeper along the journey of authenticity to reach greater fulfillment in their professional lives and to deliver remarkable patient experiences.
I am excited today because this special guest of ours is not just someone that is well known in Arizona, but it's a really dear friend of my dear friend, Dr. Allison House, and that is Dr. Michael Thompson. Thank you so much for being with us today.
It's my pleasure.
Dr. Thompson and I have known each other 25 years.
Been a great 25 years.
And so I really quickly want to share the story. I've probably said it before, where I showed up at my very first dental meeting at Bucky's Barbecue, I think.
Mm-hmm.
And there was no place to sit. And I was definitely in the minority at the time. And you noticed that I walked in and scooted over and gave me a seat. And it's a beautiful metaphor, and it really happened.
Yes. Well, I'm sure it's part of the reason you're always such a warm, welcoming person when you see someone else who's new to a process.
Because it's learned. Absolutely.
There's nothing like feeling the appreciation in your own self when someone does it for you to say, I should do this for other people.
Okay, so tell me, I don't know what this Bucky's Barbecue event was about.
It was a CAD social, and that used to be at Northern around 12th Street, and it's been torn down since then. But it was kind of a country and western barn-like atmosphere, and we were just having a social event. I think there must have been speakers, and that's why we had to sit and pay attention. So, yeah, I didn't remember that story for years until the first time I heard Allison say it. And I thought, oh, yeah, that is how we met.
But it's interesting how something small like that was so impactful for me.
Yeah.
But it wasn't impactful for you because that was just your norm.
But when I learned that, I was a new delegate, excuse me, at an AGD meeting. And one of the leaders, then, great guy named Bruce Burton, was very welcoming to me. And my first impression was, after hearing him speak in the day of events, I was walking back to my room through this hotel, and he's sitting at kind of a outdoor cafe with a bunch of people, and they're starting to have drinks and they're going to have dinner. And I go walking by alone, and he gets up and he goes, new guy, hey, new guy, come on over and have a drink with us.
I love
and,
that.
I would do anything for someone that welcoming, and, was happy to work with him for many years on the AGD board.
So I think we should talk a little bit about your story. So how long have you been practicing dentistry? When did you graduate?
1981. So 44 years.
Wow. And how did you get to Arizona?
Well, I went to the University of Detroit, which was my home. And when I graduated in 81, the economy was quite bad. And being a one-horse town, when the automobile industry goes down and it's not going to turn around quick, everybody goes down. So that was the impetus to look around. My wife and I both had big families there, and we would have stayed under most circumstances. But the economy was really bad. And so I started looking into statistics from the Census Bureau and the ADA and realized over half the dental schools are up in the Northeast. And yet at that point in time, there was a flight from those big cities out west and other places. And so
I just have to stop you real quick. You didn't look this up on the internet, did you?
look up what? Oh, no, this was
How did you do that? How did you have
well,
that
you
data?
call the ADA and the Census Bureau, and they send you reports or
Okay.
the Census Bureau published it. I don't know. Somehow I got the data.
That's
And it was
interesting.
very clear to me that the population was shifting from the Northeast to the Southwest. And so once we decided to move, it was going to be a major city in the Southwest. We knew we didn't want to live in a small town. So that's how I got here.
And did you start your practice right away?
Nope. I was an associate with a group for 18 months. But I knew in my heart I would go out on my own someday. It's really part of why I went to dental school. I liked the fact that back then in the 70s when I was scanning the horizon for a career, I liked a lot of things about dentistry, even though I hated being the patient. And one of them was self-employment, self-destination.
When you talk about a group practice, is it like a Heartland Dental? What was that like?
It was actually called Affiliated Children's Dental Specialists, and it was a pediatric group that added ortho, and now they were flirting with the idea of adding general practitioners. And they had 3 offices, and I think there were 9 or 10 docs. And when they added us, it was successful, but the success created the need to revamp so many things that after a few years, they said, we're going to stick with just pedo ortho.
Do you still have any friends from that time that practice here in Arizona?
Yeah, I mean, not really sure about the senior partners, if they're still with us or not. Rick Chait was one of them. And
Oh, yeah. I know who that is.
yeah, Rick's a great pediatric dentist and a great altruistic guy. He volunteers everywhere. And so we still see each other periodically. We run into each other. Russ Roberts was one of the other GPs. He's here in Mesa somewhere. We see each other at meetings too.
I love it.
Okay, so he said something that struck me. You said you wanted to be a dentist because there was some self-determination aspect of that.
Yeah.
Does that mean early on you felt like you could have had that entrepreneurial spirit? You recognized that you didn't just want... Okay, so...
That appealed to me. Even back in the 70s so I graduated college in 76, 77, somewhere. Almost all dentists work for themselves, but most physicians were in groups. And of course, they had to be affiliated with hospitals. They had to do rounds. It just looked like there was a lot more stress to being a physician. And I didn't have to make life and death decisions. And that sort of appealed to my personality. But the big thing was, if I want to take Tuesday afternoons off and coach basketball starting at 3, I'm doing that. I don't have to answer anybody. I don't have to ask permission. I have to make the finances work out. I may add some hours somewhere else, but I could control my quality of life a lot better.
So 5-10 years into private practice, when you did that, looking back, do you think dentistry was less stress than being an MD?
I think there's 140 different medical specialties, and they're all different. I don't know what it would be like to be a psychiatrist versus a cardiac surgeon. And I mean, the stress level probably runs the gamut. But I didn't know about all those specialties. I just generally thought, physicians have to deal with a lot. The demands on their time mean you have to take call, you have to do this and that, and people depend on you. You got to be there,
I remember when I was making the decision to be a dentist that I thought about playing soccer and the dads that came to the soccer games. And the dentist came to our games and the orthopedic surgeon didn't, because the dentist had that kind of flexibility.
Right.
So I thought that was a good profession for me because of that.
I really looked at quality of life for my family when I made the decision.
And you have 3 kids,
I do.
and you have some grandkids too,
I
right?
have 5 grandchildren. So when we all get together for our week every summer, there's 13 of us now, all because Kathleen and I got together, well, 52 years ago and got married 48 years ago.
That is amazing.
Did anyone else decide to become a dentist?
No, I'm the black sheep. Everyone else was in business, and I have 5 brothers. They're all in business, different business fields. I'm the only healthcare provider.
So entrepreneurial, that spirit runs in the family.
Yes, my dad was a CPA, had an MBA. He worked for himself, and he really talked about that in such positive ways. I think I just sort of absorbed it through my skin that would be the holy grail. Get to a point where you work for yourself, make a good living, provide a valuable service, take care of your family, take care of others.
So the practice, did you buy somebody's practice or did you start from scratch?
No, I ended up starting from scratch. I did look. Once I decided, I worked as an associate in Toledo, Ohio, where I had done my residency. Then I moved out here, was an associate. So by the time I went looking between residency and 2 associateship positions, I was about at the 5-year mark, pretty close to that. And I looked at practices, but part of the reason I came to Phoenix is its rapid growth rate. And when a big city's rapidly growing, you can just go to the outskirts of town, get established, and within 5 years, you're encompassed in urban Phoenix,
Was it difficult to grow that practice?
Yeah.
How did you market yourself back then?
Now, back then, it was still considered very quasi-unethical to advertise.
I have some recollection of this. Okay.
Yeah, I'm sure.
So you had like a Yellow Page ad and
I did have a small Yellow Page ad, yeah. But basically, it was word of mouth. And, when you're feeling desperate because you've just signed all these bank loans and you have a wife and 2 kids, and after I made the decision and was going through the planning processes 3-4 months into it, we found out our 3rd child was on the way. So, yeah, debt propulsion, motivated by, a determination to succeed. And I didn't have the luxury of time. I had to get this thing up and running. So a lot of it was bending over backwards to take such good care of my patients that if I asked them, listen, if you have any friends that also need a good dentist, would you share my name? I'm growing my practice. And, when you say that to people, they're very likely to respond, oh, yeah, I'd love to help you. You took good care of us. And that's great marketing. And it does a lot more than paying for a Yellow Pages ad or mailing out flyers.
I remember that's one of the great pieces of advice that you've given me over the years. There's a whole list of advice that Dr. Thompson has given me.
Now you're the one giving me the good advice.
Okay, so I'm curious though. So in an age where this is obviously pre-AI, pre-internet.
Pre-computer in the office. I remember buying a fax machine thinking I was hot stuff.
But what do you go to as a resource if it's like, okay, I don't know what I don't know about business and there's something that's challenging? Do you go to friends, people in the community? You go to the library and try to find a book? Like what would be your prescription for I feel stuck and I need help?
Try and find the smartest person in the room and listen to them. Now, in the early 80s when I was starting my practice, that was the library. I mean, that was the greatest resource. But I always had my father to talk to. And I had grown up listening to these stories. I have 5 brothers, so my mom and dad would sit at the end of the table and the 6 boys would be in between on benches, and he would make us all say something about what was new, different, and exciting in our life, or what happened today that was new, different, or exciting. And we had to go around the table and say something. And he would then tell us stories. And he, as we got older, he told us stories about people who were, having struggles in business and where they made mistakes and how you got to always pay your taxes and be honest and, think about the tortoise and the hare, be the tortoise, work hard. When you start investing money for retirement, be content with a fair return. Don't swing for the fences. So I just absorbed all this stuff. And I think that was one of his expressions of love. That was his love language to us is, you guys need to know stuff because I am not supporting all 6 of you forever. You've got to leave the nest and you got to do it with some skills. So he was great. And then my entire adult life while he was with us and sharp, he would read 3 papers a day and he'd cut out articles and he'd write MRT and he'd stick it in an envelope and mail it to me. And I'd get these cryptic letters and it was just, him saying, I love you and you need to know this. It- you know,
I love that.
yeah.
Sean and I both come from entrepreneurial families too.
Yeah.
I mean, was that discussion around the dinner table for you?
I mean, for us, it was one of those things. My dad was in the corporate world originally with M&Mrs. And when he left that business, I think one of the first things, we had to sell our house. So it was like, okay, financially, it doesn't seem like we're doing good. But the first thing he had us do was get around and share the dreams of when this business takes off that he's starting, what do we want in that dream house? And so he just got us all like, saying the craziest things and kind of we bought into the idea that he was going to take risk and that it was going to pay off at some point. So I got to see my dad go from like the comfortable corporate life to the entrepreneurial, leaving everything and it being financially not as successful right away. My mom trying to work a part-time job. But I just saw him like take on the world and try things that were crazy. And all of a sudden, go up to a manufacturer and be like, he started selling toothbrushes. Like that's why I'm here as a non-dentist in dentistry is because my dad created a product, distribution company. But I remember one time I was playing a video game and this is when video games were still, they looked good enough. And it was a car game. And he's like, Sean, that car on the screen, like, is that a real car? I was like, okay, just explain what you mean because I'm playing a video game. He's like, does that car exist in real life? I'm like, yeah, it's an Opel Speedster. And he's like, interesting. Next thing I know, he drafts a letter to Opel in Germany wanting to see if he can get distribution rights for that car in unique areas like Miami and Scottsdale. And it didn't work. The Opel Speedster never came to the US. But the fact that my dad thought like that is what encouraged me. I was like, he just had an idea and had the courage to bet on himself and be like, why not? And maybe things would have been different if Opal said yes and, but that door didn't open. But it didn't mean he wasn't afraid to go for it. So for me, a lot of it was just seeing his entrepreneurial spirit, go after things. I know with Allison, she talks about her parents and the way that they would advocate and lead and legislate. And I think that probably influenced her a lot, not just to be a dentist, but to be a dentist that actually makes the profession better.
So my dad was part of the coalition to make physical therapy independent. So you could open a physical therapy clinic without a physician. And the legislation passed. My dad was part of the signing of the governor. And then my mom opened a physical therapy clinic, the first one in Flagstaff. And so I spent a lot of time there. By the time I was 12 years old, I was working there. I learned a lot about business just from watching my parents. They ran payroll at our house with one of those printers that had the dot matrix. So we ran
They
payroll.
were high tech.
Oh, yeah. This was high tech.
This was way beyond pegboards.
I remember the pegboard, though. Yeah. So you learn a lot from your parents. I'm very grateful for that. Those lessons were big.
Yep. And the longer you live, the more you realize how important those early trainings were. We grew up outside of Detroit, and on rare occasions, my dad would have the courage to put all 6 of us in the station wagon and take us to a Tiger game downtown. And Tiger Stadium was not in a really great neighborhood, but he took the freeway down there, got off, parked, and went to the game. Well, we went to an afternoon game, and when we were driving home, it was daylight still, and he doesn't take the freeway, he starts driving through neighborhoods. And he goes, "You guys think you'd like to live here?" And we're looking at these houses going, "No." And he goes, "These people probably didn't graduate high school. The best jobs they can get pay very low salaries. And this is the best they can do. This is their life. So if you want to live better than this, you better work hard and develop a skill that the world wants to buy." And then we drive to a little better neighborhood. "You want to live here?" Not really. No, we kind of like our house." Now, we could have continued past our house and gone into the really ritzy areas. But his point was, there's a connection between how hard you work and what skills you develop and how you're going to live, and how you're going to raise your family.
I also learned the risk part. I'll never forget, I was maybe 10 or 11 years old, and I thought we should have cars that ran by electricity or nuclear fusion, which doesn't make any sense. But my dad arranged for me to meet with one of the physicists at the university to see if my design would work. And of course, he explained that it didn't. But just the fact that he encouraged me to think outside the box, try something, and then find somebody smart to ask, that was very encouraging to me, that you just have to try things and think about things.
Wait,
Mhm.
how old were you?
11, maybe 12. I was a little kid.
Thinking about nuclear fusion to power automobiles?
Well,
I was going to say, I think
Allison
there's a
is
future in
not-
that electric car business.
It wasn't possible back then.
But you and Tesla, Nikolai Tesla, could have been sharing some. No, I think he was way before, right?
My dad and I loved science fiction. We watched lots of science fiction shows. I read lots of books. I liked Isaac Asimov. I mean, I was into that. Yeah.
So, Michael, one of the things I heard you say was that your dad would be talking to you guys like at a family meal.
Yes.
And there's something about the family table that, I don't know, maybe people took it for granted, but was kind of like a sacred part of the family. And then at some point, I don't think people realized how important it was. And it was like, oh, it's not a big deal if we have the TV on and people eat in front and someone's here and someone's on the couch. And were you able to keep that in your family? Because you
Oh, yeah.
recognized it was something
There
that...
was one TV in the house, and it was in the family room. And we ate in the dining room. And the phone was in the dining room, and it had one of those really long cords so you could take it into multiple rooms. But you weren't allowed to answer the phone during dinner either. No, it was for conversing and sharing and bonding. We didn't say it back then like that, but that's what it was. That's what it was all about. And we always started with a little prayer: "God bless the cook, the provider, and all the good little eaters." And that was his way of saying, you should appreciate your mother and your father for what we do for you. And, you're my good little eaters, so eat up. And then when we got to a certain age, he said, "Now your mother's worked hard all day and taken care of everything. You guys can do the dishes." So then we had our share in the responsibility for the family meal.
Oh, I just think that's amazing, because I think that's one of the things that is missing now, where people
It
don't
is.
they don't just break bread together as a family,
And yet, when you really want to do something special with someone, you go out to dinner and break bread.
Okay, so I'm curious, what was one of the struggles, though, with business, starting off a scratch practice? I'm sure some of the things came more easy to you. You seem very relational, so I'm guessing getting great rapport with your patients. That's probably where the referrals came.
Well, that's developed over 45-year career. In the beginning, it was awkward. It was hard for me to ask someone to refer their friends and neighbors. I was afraid I'd appear desperate.
Mm.
But now that I'm sometimes on the other end of that, you realize, no, you just got to support new people when they start something, especially once you have developed some respect for them. Who doesn't want that person to succeed, no matter what the business is? And you realize there's a cycle to life, and, people who've done it before recognize someone who's just getting started, and they go, "Good for you." Yeah.
You told me once that you'd worked on those communication skills. How did you do that?
I've gotten a lot of good advice from over the years, and sometimes I paid attention to it. And one of those things that kept being put out for me was, you should go to Toastmasters. And so early on, I did that. When I started my practice, I had extra time on my hands. So I went to a breakfast Toastmasters meeting, and I wouldn't get to the office till 8:30 or 9 that day. But it forces you to learn certain aspects of speaking. And, people have natural gifts, but no matter where you fall on the spectrum, you can always improve by learning some ground rules and what works and what doesn't. And being videotaped and watching your own videotapes is very helpful too. So that was impactful. And then, dentistry's, one of those careers where there's a tremendous amount of science to it, a tremendous amount of business. But what really drew me to it, and I think helped me formulate the practice I did, was the relationships. There was a certain appeal to me to having long-term relationships. I admired colleagues who said, I've had these same employees for 10 years. I thought, wow, what's your secret? I want to know that.
Mm.
And then, with patients, it just naturally became relational, and we would just talk. And so by the time we're seeing each other for the 10th or 20th time, we've got lots to talk about.
You have always been great with advice. That wasn't my skill set when I graduated. I was smart and I was okay with my hands. You develop that over time. But communicating with patients was very difficult for me. And I remember lots of phone calls that I had with you on how do I present this treatment? And you shared a number of, I call them Thompsonisms. But one of my favorites was you don't downplay what the best treatment is. You always present the best treatment, because what would you want for your parents or your sister?
Yeah.
And you said it really well that.
Well, I was probably quoting someone much smarter than me.
But at the university, you're teaching the students this too, right?
Oh, yeah.
So how do you tell them to talk to patients?
I tell them that, we have an obligation to tell them what their treatment options are. And, you can read their body reaction to what you're saying and go, well, they're not interested in implants. Okay. But then I'll confirm it. And I'll say, would you like to talk about something other than implants? And if you invite them to speak up and have some dignity while they tell you, I can't afford it, or I'm too afraid of that, or, whatever my reason is, I don't want to do it. And you don't push them. You feel like, I want to help you make your decision, and then I'm going to do an excellent job once you give me my marching orders. But my job is to tell you there's these options. And if you only put the good options, that's what's in their best interest on the table, then you're going to help your patient make decisions that allow you both to feel this was successful. We accomplished what we set out to do. And everyone's going to come up with a different answer when you say, what do you want? But we had this yesterday in the clinic. A woman had a denture made and was having trouble with it. And her friend said, let's go to Mexico. They do a great job. She went down there. Well, it wasn't really any better. So she came to see us and she goes, you're not going to tell me I need a new denture, are you? I said, no. What can I do to help you? Why are you having trouble? You've had this for 2 months. It's probably still kind of new, but you should be getting used to it. And she told me what her concerns were. And I looked and I said, well, I don't know that a new one's going to solve your problem. Maybe we could talk about this or that. And then at the end, she's like, what would it take to get a new one? And what does it cost here? And I said, well, the good news is if you come to a university, we're slow, but everyone wants to do an A job for you. I want the students to be taught in a way that allows them to have high success rates. And that's what they want. They want to get good grades. And all you have to do is pay part of the bill. They're subsidizing your care with their tuition. And, at that point, she realizes I'm not in it for the money. I'm not even going to push her to do what I personally think she should do. I know at this point that the best treatment is the one that makes sense for them.
I love that. The dignity. You give the patient
Yeah.
dignity.
Okay, so I'm curious though about you guys. When did Michael get viewed in your eyes as a lifeline, and why? You're meeting a lot of people. You need help. You don't know a lot about dentistry. You're committed to it, and then you meet Michael Thompson, Dr. Michael Thompson. Like, what was different? Like, why did you all of a sudden realize, wow? Like, was it the first time you met him?
I mean, I would say the first time I met him, I knew that he was an ethical person. You could just tell that. But I think the big thing is there's a number of people in my life that I would call. But there are people in your life that know stuff that sort of brag about it, and they talk down to you in a way that it's not encouraging. I'm so much better than you are. And Michael never did that. Michael was always like, you need to think about this. He came to my office one time and I had a award on the wall that had just been mailed to me out of nowhere. And I put it on the wall and he asked me, "How did you get this award?" And I said, I have no idea. He said, "Don't do that. Don't cheapen yourself. You're important. When you earn an award, you put it on the wall." And that was powerful. That taught me about, who I want to be and who I wanted to be presented as. And so when you have somebody that cares that much about you to give you that feedback, I mean, you listen. It was important.
Yep. And today, when I go to a doctor's office and I see they have plaques up saying they're popular among their colleagues, they were voted best whatever in Phoenix, I think to myself, it's not about popularity. It's about, Now I think some of those lists are a combination of popularity and true respect, but the ones for dentists, I know sometimes you see someone there who's been out 5 years and you think, okay, that was a good marketing campaign on their part, but what does it really mean? Are you the best? Wouldn't you rather just work hard, do a lot of good post-op work or postdoc work, and you can feel when things are working and you can see it, especially if you stay put for 35, 40 years. You see your work. You have the opportunity to redo work you did 15 years ago. And, as you develop those skills, I never really felt the need to brag about it, but part of that is it was frowned upon the way I was brought up to brag about yourself. But I had to learn to at least speak up for myself and talk about my values, my mission.
You also told me a story one time about ethics. You had placed a bunch of crowns that failed. It was a material like
Okay.
a corian.
It
Can you
was
tell
made
that
by
story?
the Corningware company. It was called Dicor. And you could basically cast glass. So you literally turned it into a molten state and injected it just like we cast gold crowns. And then they put a thin layer of porcelain on it to give you the color you desired. And they didn't do quite enough testing. They rolled it out and they talked about this advantage and that advantage. And I was sold on them. I thought this might be the new thing. So after I'd done about 50 or more, I noticed I was starting to have failures. They just broke under normal use. And this is pre-internet. There was no chat site you could go to and say, is anyone else having trouble with this? But you could talk to your friends and they go, yeah, we're not so sure this is everything they promised. So after I had replaced a few, I looked into it and I could see that, yeah, they kind of overplayed their hand. This isn't strong enough. So I looked up everyone I'd done one for, and I had to actually pull their charts. We kind of went by the appointment book. We figured it out. And I just sent them a letter and I said, this new material came to us with so much promise, but I have noticed the breakage rate is kind of high. And so I'd like to redo yours at no charge. And,
I know. That's a lot of ethics.
That's crazy.
it is, but it's also an investment in marketing the value of going to a dentist who will tell you the truth. And the truth is, hey, we all got fooled. It wasn't as bad as the opioid crisis. That we all got fooled on that one too. We were told you had to do this to be a good dentist, keep your patient comfortable. Anyways, I don't want to go down that path. But anyways, yeah, that's how I dealt with it. And I'm not the only one. I probably got the idea from somebody else and said, this kind of reflects how I feel about this. And I didn't want them trickling in year after year, replacing 2 or 3, because some of them would never get replaced. They'd go somewhere else and they go, oh, that dentist back in Phoenix must have done a bad job for me. But yeah, it was just my decision. I'll handle it this way. And
I remember being very impressed by that, though.
thank you. I think it was the right thing to do. And certainly no regrets, even though it cost me a few bucks.
The other thing that you taught me about was pricing. I was having trouble figuring out how much I was supposed to price for veneers or cosmetic cases. And Dr. DeWood, Gary DeWood, had spent some time with me with numbers, but I still couldn't figure out how to build in some wiggle room. And will you tell me, will you tell the
Well,
audience?
yeah, if you charge very, very low fees, your margins don't really allow you the budget to say, I'm going to redo the 2 or 3% that don't work out well. But if you look at that as a cost of business and say, okay, just like we buy insurance on lots of things, I'm sort of building an insurance factor into the service and saying, I know I may have to redo some of these. So I'm not going to charge rock bottom. I'm also going to allow myself to take more time and do the kind of work I would do for a friend or for family and do it for everybody. And then your failure rates go down even lower. But yeah, I think
the words you used were, you're only as ethical as you can afford to be.
that's right. And so you need capital to be ethical.
To redo whatever you have to redo.
Yeah.
Because none of us are perfect.
Well, no, we were taught an imperfect profession by other imperfect people, and we practice on imperfect people. And there are so many variables that determine successful dental treatment, and only so many are under our control.
Since you came up in a slightly different era from the young dentists today, there's so much talk now about burnout. I don't know in your generation if that was something that was talked about, discussed, if it was even okay, but it doesn't mean that it wasn't there, right? Like there still might
Oh,
have
it
been.
was there. And I remember someone telling me, oh, you're a dentist. Well, congratulations. Dentists are in the top 5 for divorce, alcoholism, and suicide. I thought, why aren't you a cheery soul? But I think there was some truth to that. It may have been a little exaggerated, but it did make me think, well, why? And, it depends on the mental self-talk. If you have negative self-talk, it's not going to take very many years before you convince yourself you're in the wrong profession. This is no good at all. I don't make enough money. I feel miserable. I find myself being pressured to recommend things that, I don't feel good about, but that's why I've always watched the overhead and then charged a fair enough fee that allowed me to do excellence. But, you have to be competitive in your neighborhood too. It's very much a neighborhood business. Not that back then you could really compare doctors' fees that easily. It's still hard to know that. But we know where the costs are in providing those services. And if you don't factor in, hey, there should be a little bit for my retirement in that fee too. And there should be a little bit for insurance in case I have to redo that. And, I usually get the staff bonuses in January. And, I got to factor all that in because the value to the patient is they return there year after year. And there was always a competent team around me. I was always there. But we didn't hire the cheapest people and we didn't skimp on training. So that's the value proposition. I was interviewed once by one of the local news stations about people going down to Albagones, Mexico,
Algodones, something, yeah.
right over the border when you leave Yuma headed to San Diego. And they said, boy, we've been down there. Their offices are just as nice as some of these offices in Scottsdale. They have the modern equipment. And I said, well, the facility costs, your rent or mortgage plus your tenant improvement loan and whatever investment you have in furniture and fixtures, 8 to 10% of a dentist's budget typically. People are 50%. That's where they're saving money. Plus, they answer to different authorities that patients in the United States can never really access. So you're kind of on your own. But yeah, that's what we had to do.
I'm just going to go back to pricing one more time because you also taught me that it was reasonable to charge, because I do think some of that self-talk of can I really ask this fee? Am I really worth this? Is this service really worth it? And you told me one time that what we were doing was important
Yeah.
and our education was important.
Yeah, I think we are all naturally drawn to healthcare because we want to help people. We have a nurturing side to our personality. And that makes it awkward to say, oh, and by the way, you have to pay me for that. And here's the fee. And you have to get past that and realize this is not sustainable without the right income and outgo. And that's something I've got to take control of. So, yeah, watch the overhead, but charge enough that you can operate in the way you've decided is your standard of care.
Bill for what you do.
Yeah. I mean, I took a class from a guy who had a very popular CD he was selling, the 15-minute crown prep. And if you watched his CD, he talked a lot about the ergonomics of setting up your room right and knowing exactly how many cotton rolls you use on average for that procedure and having it ready. So, but then there was a 15-minute segment where a guy sat down, was anesthetized, had a crown prep done, impression temporary, and was out of the chair in 15 minutes. I thought, this is a great study in efficiency, and I would never let that man in my mouth.
Never.
No. And what's the point of rushing? Because, I think a dental education sort of gives you the ability to appreciate how precious teeth are. They're not optional body parts.
And once you cut it, it's
for life.
gone.
That's one of the stresses in dentistry is we make irreversible decisions all day long. I'm going to cut this deep into this tooth. I'm going to use a liner or not. I'm going to do this or that.
Yeah, it's a million decisions.
They're stressful.
Yeah.
But they happen over and over again. So you can develop protocols that address those. And then it's not like you're making new decisions. You say, no, we already made that decision. We're giving ourselves enough time. I realize if I cut my crown prep down from an hour and a half to an hour, I could mathematically prove to you that it's feasible to do more services and generate more revenue. But at one point along the way, halfway through my career, I came to a decision that my goal had to be 3 parts. That I wanted to drive home at the end of the day feeling that I was well compensated spiritually, professionally, and financially. That's a winning day when you feel like, okay, financially, everybody did well today. They paid a fair fee for an excellent service. I provided it. I feel good about that. Professionally, any dentist can look at that and say, hey, Thompson did a good job on that tooth. Or, boy, you really restored your mouth nicely. And then spiritually, I just want to feel like I really helped my fellow human being. I didn't do anything I wouldn't have done, just because of money or to save costs by cutting corners, And once I had that clearly in my mind, and I used to drive home and think about that, Maybe this one wasn't a financial success, but spiritually and professionally, I feel good about that. And actually, when I started doing volunteer work, I remember one of the first times I ever volunteered at this children's clinic, and we didn't have to talk about money. It was just, here's your 2:00 patient. We don't know anything about him. But after an exam and x-rays, I can say, well, we can help them with this. How much time do I have? They said, well, we got a waiting room full of people. We figure 45 minutes per kid. And it was so refreshing to just say, it's all about helping it and healing. It's not about money. And they're fine if I tell them I want an hour, And I drove home that day buoyed up about the value of what I had learned to do. I was hooked.
We did the Mission of Mercy together. I remember driving home from that just with more appreciation for what I do every day. Because
Oh, yeah.
if you don't crown that tooth, if you don't do the filling, this is what happens. Now we're going to pull a bunch of teeth. People are in pain. It was just a reflection that I didn't always understand what I was doing was so important until you see what happens if I didn't do it. And that was powerful for me. That reminded me that what we do is really important.
It is. My oldest daughter now teaches first grade in a very low-income area, and she sends me these pictures of her little 6-year-olds smiling at her with rotten teeth that need to be removed,
Mhm.
and it rips at my heart,
It does, because you know how important that is for
and it was
everything.
preventable. And,
Yeah.
I really think the biggest impact we could make is to get into the schools and teach kids to brush and floss properly, how to prevent disease, because there's too much out there. We can't drill our way out of America's dental problems. We have to go back to the beginning of the pipeline and say, "This pipeline's got too much water in it. We gotta do something." And, we for the 3 of us, our teeth are assets, but it doesn't take very long for you to have your teeth become liabilities, and that's why we eventually have to take them out and give you the best substitute we can come up with. But, it's kind of an amazing thing that we have this one part of our anatomy that can be spectacular, or it could really be life-threatening. There are a few hundred people every year that die from infections that start in the mouth and spread. So we don't think about it in that way. We just think about you need your teeth back. You need a healthy dentition to function in the world.
And I didn't realize how important it was because I took it for granted having good oral health practices until I volunteered at the Mission of Mercy. And again, I'm not a dental professional. Like, what do I have to offer being there? They were like, well, you could help manage the line outdoors because I was there like at 6 in the morning. And I was like, oh, like there's a line? And they're like, yeah, they've been here, some people for 2 days camping out. And so right off the bat, I'm like, okay, I don't understand why people are waiting in line. And then I don't necessarily know if I'd be hanging out with these individuals any other time in my life because, like you said, like I don't just normally rub shoulders with low income people that might be pseudo homeless, right? So there I am monitoring the lines, and I'm just social. So I want to start talking to these people, even though some of them, again, they're just not typically people that I would hang out with. And I was having such a good time getting to hear people's stories. And this one woman individual, or in particular, I'll never forget. I was like, why have you been here for like 2 or 3 days? And she's like, look, I've been shot. I've had 3 children, and this tooth abscess hurts more than those pregnancies and being shot. Like, I am, like, it's unbearable. Like, I'll do anything to get out of this pain. But she couldn't afford going to
Yeah.
the dentist.
Tooth pain is inescapable in a way that, like, if you hurt your foot, you can just not walk on your foot all the time. But a tooth is every time you move your mouth.
Mhm.
It's pain you can't understand unless you've had it.
We have at A.T. Still University, our dental clinic divided into 4 m- critical care units. And there's an emergency chair in each one. And every day we see people come in just like those patients we saw at the Mission of Mercy. And one of the questions I always ask is, did you sleep last night? And, dental pain will just ruin your life. It'll stop it on a dime and say, no matter what you thought you were going to do today, you're going to seek relief.
You
And
can't
hopefully
sleep,
it's,
you can't eat. Sometimes you can't talk. It's important. Yeah.
yeah.
And the immediate impact on confidence. Someone all of a sudden chips a tooth, loses a tooth. They don't look at you in the eye.
Mhm.
They don't smile the same way. And that, it just impacts your overall feeling of like the sense of who you are just from a smile. So the ability to restore confidence, it is absolutely life-changing what you guys do.
And we forget that. But every once in a while, a patient will remind me, when I did those 4 veneers, all of a sudden they got married, they got a promotion, their whole life has changed just because of some confidence to smile across the room at a person.
Yeah.
And that matters. I also have patients that would come back and lose 30 pounds. Like, how did you lose 30 pounds? Well, now I can eat.
And I feel better about myself.
Yeah.
I have my self-esteem went up.
So I made all these changes, but it was one thing, but it was an investment in your life and who you are, and it just a ripple effect.
Yeah.
So it is amazing.
It's one of the great rewards of dentistry is being able to take people through that experience and go from a sense of embarrassment, discomfort, lack of confidence, and then get them to a point where they think, thank God I'm back to normal. And a lot of times I'll tell patients that when they come in to the school and they have so many dental problems, they just can't see their way out. And I'll say, if you'll stick with us, we'll get you to a place where we've run out of things to do. You'll be whole and healthy, look good, feel good. Those 2 sentences just win them over. They go, well, yeah, that's what I want. I didn't want a DO on 15. I want to look good and feel good.
Yeah.
I want to be whole and healthy.
See, these are the liners, the Thompsonisms that I repeat. I want to switch gears. I want you to tell us how you got to the school. You sold your practice.
Yes. So I was 67. I was toying with the idea of phasing out, but after building that practice for 30 some years, I was coasting on easy street. I mean, I came to work every day and smart people had that place ready to go. They'd scheduled appropriately. It wasn't going to be stressful, but we were going to profit financially, spiritually, and professionally. And everyone called me doctor. They were nice to me. It paid me money to do it. And they appreciated it. Why would I want to walk away from that and chase golf balls? That doesn't appeal to me at all. But I had developed this swelling in my leg, and I had gone to the doctor, and he goes, well, maybe you have a thrombosis. Let's do a Doppler, ultrasound. No, that wasn't it. Well, now your skin over there looks weird. I want you to go to the dermatologist. I thought, okay, I'll go get the cream from the dermatologist, and we'll figure out why my one leg is swollen. Then they did a biopsy, and they came back and said, you have cancer. It's lymphoma, and it's pretty advanced. And I said, you got to be kidding me. Ankle cancer? I mean, this is all I came to you for. You're ruining my life with this. But, I've always had the kind of personality where I'm good in a crisis. I can just block out the noise and say, what do I do next? What's important? So, I went home and told my wife, and, we told the kids. Within 24 hours, I called a practice broker I knew and respected, and he said, I'll be there tomorrow. So practice went up for sale, kind of on the down low, but my staff knew there was something wrong with my ankle. They noticed the swelling too. So I had one dental assistant, Kathy. She's really, really a smart person. She figured it out. She knew it was big, and I told her, she goes, I knew. I said, yeah, I couldn't keep it from you very long. I'd like to keep it from the others till Friday, okay? Okay. So anyways, I knew it was time to be very decisive. And so I think I was diagnosed on a Wednesday, had the broker in the office on Friday. We put together, crunched a bunch of numbers, put together a prospectus, and people were coming to look at it within 3 weeks. In the interim, I had to get my port put in, and I had to go schedule a bone biopsy. I had to find an oncologist, meet him, settle on a treatment plan. When you sign up for chemo, you get, in my case, it was every 3 weeks, and it was about a full day to do it. So you have to block those out right away. And then fortunately, I had the good sense of taking the advice of colleagues who said, you really should form an indemnity group in case somebody has a death or disability, an accident where they can't practice. If you all agree to cover for each other, that is the best assurance that your practice survives this and actually can maintain its value. So Allison and I had formed one with about 18 other dentists. And the agreement was you'd work a half day, 2 half days a month. And we'd had this agreement. I'll be there for you. You'll be there for me. And you don't need practice overhead insurance. And it was just an honor-bound commitment. And we had it for 25 years and never used it. And I always thought I'd be the helper dentist. I really never could imagine a scenario where I would be on the other receiving end. But, my card came up, and I called Allison and another good friend, and they said, we'll take it.
So we covered his practice. We've talked about that. And it got sold.
Sold within 90 days. We found a great successor, philosophically aligned with the type of practice I'd built. And when he found out it was being supported by volunteers who were coming in, taking absolutely no compensation, leaving all the revenue in the practice to pay the bills, pay the staff, he said, well, let me take over. Because I didn't really want to be a burden to my friends who were doing this. I think some of them cycled through twice, but a lot of them only once. And we just knew what we had to do and we got it done. But then he volunteered for 3 or 4 weeks. Now, at the time, we were trying to close the deal too. So fortunately, it all worked out. It could have been a problem if it didn't work out at the end. But I think there was sort of a spiritual commitment. We're going to do this. Let's get the numbers right. Let's figure out what works for you. And once we knew we were a good fit, we didn't look back. We did it.
He is wonderful.
Very nice guy. He's my dentist. He takes care of my family. Good man. And anyways, I became a full-time patient for about a year. And I had stage 4 B-cell lymphoma, had metastasized. So they said, here's what we're going to do. We're going to do the chemo. We're going to follow up with radiation. You got to have a couple minor surgeries along the way. And so we go through all of that, and cancer comes roaring back. It was a speed bump. They said, oh, well, we changed your diagnosis to refractory stage 4 metastatic B-cell lymphoma. Yay. But it qualified me for a type of immunotherapy that up until just 4 or 5 years earlier had been experimental. And it was a new thing out there, CAR T immunotherapy. So what they do is they put a chimeric antigen receptor on your T cells in a laboratory, grow out a whole bag of them, and re-inject them. And within a matter of weeks, the newly engineered T cells killed all my B cells. They're not able to just get the cancerous ones. So I had to give up the entire part of my immune system that B cells make your antibodies, so I can't make my own antibodies anymore. I get a bag of other people's every 21 days, and I still have my chemo port where they just plug me in, and that's how every third Friday morning goes for me. I just sit there and read or take some project to get done. And
so you beat this cancer.
Yeah, that's a little bold. I'm really reluctant to say that. They don't even use the term remission anymore. They just say no evidence of disease. So here, I was at a pretty dark place. I had all this treatment. I think 18 radiation treatments, 4 types of chemo, and a couple surgeries, and they're telling me it didn't work. And it was a really bad bug you got there, really bad form of cancer. So I just accepted that this was it, They collected my cells, and they spent 3 weeks at a lab in Pasadena. And during that time, my wife and I went up north and rented a little cabin on a lake and just had a very peaceful weekend. And she took this picture of me sitting by the lake that you can just see in my eyes. I'm serene with the acceptance of, all right, it was a great life and it may be coming to an end. And that's biology. And I've studied it my whole life. I knew that's the way it works out sometimes. So, and considering this was the backup plan, I wasn't that optimistic that the B plan was going to do so well. But 8 weeks after I was re-injected, I had a scan that showed no evidence of cancer in my body. And they've repeated that every 6 months for 5 cycles. And they said, we're not going to x-ray you anymore because you're 5 for 5 on the good news and we can't justify the radiation anymore. So yes, I've been incredibly fortunate. It's really a story that's too good to be true.
And I think it's changed your perspective on life.
Oh, yeah. dramatically. I went being busy, being interested in lots of different things besides my practice, enjoying my practice thoroughly, to running into a brick wall. And it was after that Tuesday afternoon appointment, my life would never be the same. So there was that acceptance that this could be the end, the tremendous appreciation for the moment where they said, we see no evidence of cancer on a PET scan. And, but they said, you're missing half your immune system. So we don't know. You better be careful out there. Should you get this vaccine or that? Don't get live vaccines anymore. A lot of precautions. But one of them was just going out in public. So I really ventured out, a puppy finding out the world's out there and trying it, but not being sure this is safe. Can I go to a movie again? What if I breathe in, bacteria and viruses of all these people? Will I get sick? And then you do a little. That's okay. You take a bigger step. That's okay. Now I'm teaching in a dental school and I'm around a lot of germs, but I must have a good enough one. Plus I get the antibodies I get come from at least 100 different people pooled together. So some have been vaccinated for this, some for that. Some have had this, some have had that. So I'm getting a broad base and it's worked out beautifully. But yeah, I went from accepting that the end was nigh to, oh my God, this can't be true. It can't be this good. To, yeah, after 2.5 years, we're 5 for 5. I still don't know what's coming. I know that after 9 or 10 full body CTs and PET scans, there's going to be consequences to that, but only if I live long enough. And every year's a bonus. So when I thought this was it, I reflected on my life and I was so happy that I married the woman I did, had
No, I understand. It's a big deal. You have accomplished so much. And I love that after you've been through all of this, you didn't decide to just go play golf. You decided to enhance the next generation. I love that.
Well, when you think this is it, you can look back and say, what's my assessment on my life? And like I said, very appreciative to have had the family I did. But the parents, the brothers, my wife, my kids married great kids, giving us 5 great grandkids. I mean, we have been blessed way beyond what you could hope for. I mean, really, all 13 of those human beings are living good lives. They're healthy, happy, well-adjusted, and productive. I mean, it's been a great tribute to my wife and me. I helped where I could.
But dentistry gave you that.
And then looking back on my career, I thought, well, I contributed to my profession through volunteer work, through leadership activities. I ran a successful practice. I took good care of people. I'm proud of everything I did. Even though I made my share of mistakes, and I try and tell the students this, you're about to embark on a 40-year career, and you're probably going to bat 900, maybe 950. But you're going to have your mistakes and you have to learn how to accept them, make things right, move forward, and forgive yourself. I always tell them, learn the lesson, forget the failure.
I love it.
Let go of that emotion that I screwed up and go, yeah, I'm not doing that again. I learned those Dicor crowns don't work that well. I think we all learned it because they're not here anymore.
But there will be something else, just the way it works.
Or just the fact that I don't know why I couldn't reach that patient, why they left unhappy with me. And we do take it personal. It is, our job is to invade their body and we are literally right in their face. And all 5 senses know what you're doing when you're doing it. And so, they have to lay back and submit. It's against everything in the animal kingdom to just lay back and go, okay.
Can't see what you're doing and just let you do it.
Got to have trust.
Yeah.
If you have trust, everything works out great.
So we interviewed somebody who talked about AI last week, which was fascinating. And you were mentioning, like, the students, what will their lives be like with AI? Some things they won't be doing that we've done. But you did mention that maybe there's a human piece of this that will always be
Well,
there.
I can't, after the life I've had, believe that people will find it an apples to apples comparison to saying an AI driven robot restored my tooth or Dr. House restored my tooth. I think those will always be apples and oranges. And we were talking about this earlier, that even if they can develop sensors that tell when your body temperature just went up a half a degree and tell the machine to back off now, they're getting nervous, or I can sense change in blood pressure, so do this. I mean, that's incredible data that we don't have. But on the other hand, we intuitively sense these things because of our humanity. Our five senses are on alert too. We're watching, listening. When I have to watch my students give injections, I always tell them afterwards, I was watching their fingers and toes. That's the clue. I said, now you can't see their toes in your peripheral vision, but when people will let you know. So anyways, I think that personal experience is incredibly comforting to the patient. And even though I know the robot is much more precise than someone who's got all these different joints and muscles and they have to coordinate everything for this to work right, they care. And I know that because I talk to them. And all my humanity is on alert that says, yeah, I can trust Dr. House, and that's incredibly comforting. And I'll tell you, one of the chemo treatments I got, my cancer had a propensity to spread to the brain. And my doctor said, I'm going to protect your brain. So I had to get 4 of these sessions every 3 weeks where I would lay down on the table and a interventional radiologist would come into the room and give me an epidural, basically. But they put chemo in there, not anything else. And the idea was, if cancer cells are floating up here in numbers we can't measure, they're going to meet the methotrexate and they're going to die. And he's not going to get brain cancer. So that was the whole theory. When I would have that done, I'd arrive, I had to undress, go in there. The staff would get me on the table and get this lined up because they advance the needle, take a picture, or they actually suit up like spacemen, and they advance it continuously with live feed images that tell them we're up to the epidural, we've entered it, now we inject, now we retract. So 3 of the 4 times, the doctor comes in the room, looks down at the table. How you doing, Mr. Thompson? Most of them didn't know I was a doctor of any kind, so they were being polite and courteous. And they would tell me what they're going to do, introduce themselves, and they'll say, you're going to feel a pinch, and I see you've had this done before. It'll be just like last time. We'll be very gentle. And I love those 3 doctors. They're all different because this wasn't a practice. It was the hospital service. But there was one doctor who came in the room. She talked to all the staff. I felt her hands on my back. Never once said a word to me. Probably did as good a job as the other 3, but I hate her. She was cold and impersonal. I didn't realize I'm down there with my beating heart saying, I hope you don't sever any of my spinal nerves. But in addition to that, I'm fighting cancer. I'm in a certain emotional state. You even said, hello, you're going to invade my body. Like I said, I appreciate the value of her technical skill, but because she acted as a robot, I would never sign up for that again.
That is another important lesson.
Yeah.
And how patients need to be treated.
Yeah.
It's hard to be the patient.
Slowly over generations, we may get desensitized. I mean, when they introduced elevators, they had a special elevator operator in there to make sure it was done right. And we don't feel we need that anymore. We trust that machine, right?
Yeah.
We may get
even self-checkout, all of a sudden it became impersonal.
Yeah.
And it's like, well, that's kind of weird. But now it seems like people are fine with self checkout.
So, Sean, you're of a different generation. What do you think? Do you feel like that personal touch is important? Maybe it's not as important.
I mean, when I hear his story about how 4 experiences, 3 had that personal touch, and the one that didn't, it was completely different. Like, I remember one of my medical things, a few years back where I had to get kind of a procedure done, and I was just so uncomfortable. I was, like, embarrassed, I was nervous, and the fact that the care provider saw me and kinda cracked some jokes and tried to make me feel better about it, it changed my entire experience. And it's like she understood it and
Mhm.
saw me as a human that was just really nervous and gave me some compliment that just took me to the moon, and it just changed the whole experience, and I was like, "Man, if it was this cold, sterile, inhuman experience, I was feeling scared and alone." And that humanity, her meeting me in my humanity, changed the entire experience. So I don't think I want something sterile. It's not about just the efficacy of the outcome. Even if it needs to be guided, but it's still gonna be a robot, I still want warmth. I want human. And I think there's always going to be a place for that in healthcare.
Yeah. I I think as the generations unfold, you will find more and more people accepting of it, just like we accept the checkout line or the elevator without an operator. But I can't believe it's gonna go away. I think this is hardwired into human beings.
Just from we talked a little bit about burnout and the depression that we're seeing. I think it probably is a piece of the loss of connection that we used to have with other human beings, where we went places and we talked to people. I think I think that people need other
Mhm.
people. We can't lose that. We can't lose our humanity in that way.
I hope not.
I was just with my family at Chipotle. It was after a rock climbing competition, and we're in line. Sorry, we get our food, sit back down, and I'm watching the people in line. And every single person that was in line at Chipotle was just, and I was like, if you would have taken a picture of this 30 years ago and shown someone, they'd think like, okay, that's like some dystopian future where you're just joking. Like, it's never going to get that bad where people are so immersed and glued into a device.
That's
And
supposed to provide connection,
right.
but
Yeah.
doesn't.
And here we are. And it's actually real now. And I don't think we're better for it at all. And supposedly that was the goal of Steve Jobs, though. I want people to empty themselves, who they are, into this device. And yet we need this. We need the table where you sit across your kids and you just ask them, like, how you doing? Is everything okay? That foot where you see it in your peripheral and you understand, oh, the patient's going through some pain. Your kids have their foot the mannerisms, the twitches, the
Mhm.
things that they do emotionally when you make yourself available to see them.
Yes.
And you wonder why so many kids and the young generation is like in so much pain and going through so much right now. It's because no one's seeing that twitch.
I
Well,
think that's a good analogy. It's true.
you explained that very well, and I think a lot of us just intuitively get that, but we can't articulate it as well as you did. But, my wife and I figured out after we had 3 kids, it really didn't make sense for her to work. She was a social worker, which they're traditionally underpaid for the value of what they do. And with 3 kids and childcare costs, it just would have added a lot of stress and very little net income to the family. So, and my prospects were good. So we were doing fine. We just had fewer toys, but we had all our needs met. And she was home. And she would tell me stories at night. When this child came home, this is what they told me about school, or this is what they said about this friend of theirs. And I said, really? Because I asked them at 5:30, what's new? And they said, nothing. And she said, there's a difference between when they walk in the door and it's right on their mind, they'll talk.
Mhm.
And when you come in later, they've had a chance to be heard and, they're on to something else. But if you really want to know, it was so valuable for her to be there when they first walked in. And she would sometimes do something with her friends and she'd say, oh, I got to get home. The kids will be home at 3. And they go, well, they're old enough. Why don't you just let them in? She goes, no, I want to be there, and that's what it had evolved into. But when 9/11 happened, a lot of our children's friends, they were sent home from school early that day. They were going home to empty houses. They all ended up at our house.
Yeah, it's important.
It's emotional time. You want to be with people.
Yeah.
That is such a special memory. That speaks volumes that everyone ended up at your house, like seemingly probably the most disruptive moment in American history over the last 50 years was 9/11.
Oh, yeah.
And to think when kids didn't know what was going on, they ended up at the Thompsons. That says a lot, which is probably why you've been able to step into such of a educational and nurturing role as an expert in dentistry.
Yeah. It's,
The students adore him. They just adore him. It's really nice to see.
well,
We went
it's nice
to
of you to say that.
we went to a thing last week,
Yeah.
and the students just hung on every word. It was, I think that they dream of this life. I don't know if they'll have it, but they dream of the life that you had and the practice and the family. And I do hope that will continue, that dentistry will still be someplace where you can have that kind of a life.
Well, when I got my life back and I asked myself, what do you want to do? And I was fortunate enough that I saved prudently my whole life. When I got the diagnosis, we sat down with our financial planner and said, well, we're going to stop putting money in the pot. We're going to start taking it out. I knew I was okay. We were okay financially. We didn't have to worry about downsizing overnight or.
So this job at the school is not about money. What's it about?
It's about human connections. So I derive a therapeutic benefit from being needed. They derive a benefit from my being able to tell them, I've done this for 40 years and I've learned a few things. The school has very high aspirations for what they're going to teach these young people, not just dentistry, but caring. And, they succeed at that. And I'm proud to be part of that.
I've said already that you've taught me lots of lessons over the years. But one of the most recent lessons that you taught me was you have been to the edge and back. And I was going through some hard times. And you told me, Allison, when I look back at my life, I don't regret the things that I did. I regret the things that I didn't do. And that was really profound for me to think about, that I don't want to regret things. I don't want to look back and say, wow, I really should have done that.
And a lot of that came from, those moments where you don't feel you have quite enough courage to say this or do that. And
Or
those
open
are
a
the
practice.
moments I would have liked back to say, I'm going to do this differently. But, who can't say that? They were there, but, wasn't the dominant feature of my life by any means. I mean, I was very proud of the life I'd built professionally and personally. I'm one of those people that is very content to have a handful of good friends. I don't need to be going to a party every Saturday night. I love good friends. And, when I got diagnosed, my friends came to my aid.
You've been a good friend to all of us, too. Yeah. You had something you wanted to ask him about the next generation.
Oh, yeah. Yeah. Well, there's a few things that I want to ask him, but I was just going to sit with this just a moment, just about your friends, because that's just a beautiful thing to acknowledge.
And there was a period where they thought I might need a stem cell transplant. All 5 of my brothers signed up.
A life well lived. Yeah.
It's a gift.
I felt very well supported.
Yeah.
We talk about this a lot, where it's like, if you climb a mountain and you get to the top, but you look around and realize you don't have anything and no one's there with you, what was it's the wrong mountain.
What was the point?
And here you are, and you've
Yeah.
gotten to the top of your mountain, and you still have your family, your friends,
Yeah.
your siblings.
And I have a opportunity to work with young people at the start of their careers and tell them these things. I was talking to one of my students the other day. I said, what are your plans after school? Where are you going to go? And he goes, well, I've been dating my high school sweetheart for all these years. And, she wants to go here. I want to go there. But, I think we're going to get married. And I said, well, you better decide that. I said, you don't know when the right person's going to enter your life. You got to be smart enough to know that's the right person. And I said, you better lock this down.
That's amazing that you said that, because this generation, it's so like laissez-faire. Like, I don't know, I'm just kind of go with the flow. And yeah, I really like this person. We've been with each other for a long time, but it's like the courage or just the decisiveness to have someone else say, there's no guarantee. So
Right.
like, Duke, what are you going to do about it?
And it was apparent to me that he'd found the right one. This was his person. And I just, so I had dated my wife all through college, and I got my acceptance letter at dental school. We went out that night, and I was telling her, and I was full of enthusiasm. I had all these stories and ideas I wanted to share. And then she goes, well, what's going to happen to us? And I said, well, I'm going to dental school in town. Probably going to live at home for a while and figure that part out later. But she goes, no, you're going to get so busy. And, I said, oh, we'll always see each other. She goes, no, it's going to change. It's going to be different. And I said, well, let's just continue to date. She goes, well, we've been dating 4 years. You want to date 4 more? And it just hit me that, that isn't really realistic or fair to her. We're kind of at a decision point. I'm going to take on this 4-year project that is going to consume my life. All my waking hours, I'll be thinking about, am I ready for this next test? Do I have all my work in on time? Even though I didn't really comprehend how hard it was going to be, I knew it was going to take up all my time. And I thought, all right, she's telling me I have enough self-respect to tell you I am not going to sit around and wait and watch this relationship dwindle and then have you, just run the risk that one of us tells the other, I want something different now, you know? And so we got married the month before dental school.
Seems to have turned out pretty well.
48 years and counting.
Okay, so one of my questions is, you seem like someone that has a lot of wisdom, and I think wisdom allows you to learn from other people's mistakes. But yet dentistry is so difficult that I'm sure wisdom alone didn't allow you to just figure everything out in those first 10 years. Like, what would be a moment in those first 10 years where you really struggled, or what was a common struggle? Like, let's say you figured out, okay, you're having an issue here, but you figured that out pretty quick. What was something that maybe was more persistent, that you really valued the growth that you ended up having or overcoming because it was harder to come by?
I think managing people was the hardest thing. I'm analytical by nature, but, I like people. I like being around people. And I think I've had very good long-term relationships with my family and friends. I've had very good short-term relationships with my patients. But my employees kind of fell into a group I wasn't ready for. I had to be their supervisor. I was responsible for their income. And, given the demands of the job, the hours, the pay, a lot of it impacted their quality of life. And I was real sensitive to that. I knew that I need to give them raises and guarantee a certain number of hours. And I remember at one point, it was just a struggle because from an accounting standpoint, you can look at personnel as a fixed expense or a variable expense. If you look at it as a variable expense, you're not going to have loyal employees. So instead of saying, She makes so much an hour, and if I cut the hours, I save money. But you just cut her ability to pay the rent. And how long is she going to put up with that? And even if it's within that margin of what she'll accept without quitting, do you really want to be there? I don't. Someone once told me if your employees have to come to you and ask for a raise, you've waited too long. Considering they're probably average people that average values, that they're telling you, I can't get by. I've reached my limit, and no one thrives in that situation. So I took that to heart, and I said, okay, we're adjusting salaries annually. We're going to have bonuses. We're going to do this. But employees and managing them was always the biggest challenge for me. And I think it's because it's a relationship where I had control, a level of control over their life. And, without good communication, things can build up to the point where they say, I'm quitting, or, can we talk after work? Oh my God. So 2 weeks from today is the 13th, and that'll be my last day. And that just, I got better at it. It was never comfortable,
Was there ever a time where you felt like, I don't know, early on, like I feel close to not being able to do this anymore? Or like, were you ever entertained? Not quitting, but maybe just like,
The only time I really thought maybe I was in the wrong profession was I first moved to Phoenix. I was working as an associate, but I was also teaching a class at Phoenix College. It was combined class on medical problems in dentistry that we taught to the hygiene students and the dental assisting students. And as part of that, we would cover all the body systems one a week. And here's the things that come up. And if your patient has this, here's how the dental care has to vary. And they offered me an opportunity to go to USC and take a 2-day class on medical problems in dentistry and bring that back and incorporate it into the curriculum. So I went to the campus at USC. All day Friday and Saturday, they showed us slides of young, healthy men coming into the clinic with these strange infections. And every case study ended with, and then they died. And then they died. And this was the start of the AIDS crisis. So the first cases were reported in 81, the year I graduated, but the word didn't really spread.
Mm.
And then it started spreading, but they didn't even know it was a virus. They didn't know in the beginning what caused it. So kind of like with COVID, a lot of fear and not a lot of facts.
Mm.
And anyways, after 2 days at USC and watching all these young, healthy people die, I came back and said, I don't think I want to do this. Someone had told us in dental school that you can catch almost anything through the mouth. So you better wear gloves and masks and everything and be aware of the fact that, from a microbiological standpoint, this is risky business. But you never had to deal with a disease that at one moment in time was killing almost 100% of the people that contracted the virus. So that was the only time I thought I should walk away. At every other time, I've just thought I need to do something a little different. This part is hard. Go learn about that. You're having trouble communicating, go to Toastmasters. I was one of those guys that always just knocked on the next wall until I got through it.
So you think even today, like I feel like it's a different time where just how fast everything's moving. Like I can't imagine being a young dentist today where it's like, what is marketing? I don't know. It could be like you can successfully do marketing like 10 different ways and fail at marketing 100 different ways. With the technology, like what do you need in your practice in order to be able to be a great dentist? Well, it seems like, I don't know, just the rate at which everything's changing. I'm sure someone like you would have succeeded because of your adaptability. But a lot of dentists, I feel like today are much more scientific and less entrepreneurial by nature, maybe.
Oh, yeah. It still seems odd to me to hear our senior students talk about where they're going to get a job. Because when I graduated, where are you going to establish your practice? Where are you going? It was just assumed because 9 out of 10 or more of us went into our own practices eventually. You may start off associating, but that was, a means to an end. It wasn't where you were going to live. We were all going to go out and stake our claim in the world.
So you are an incredibly optimistic person, but is there anything you're cautionary about when you're looking at the next 10 years with dentistry?
Oh, a lot. Compared to the life I led, I literally started with a pegboard. I got my first computer 8 years after graduating dental school. So I see a lot of things, but they all have one thing in common is they're driving up the overhead.
Mm.
And out of necessity, you're going to have to work in groups because just the investment in technology and to keep it running. I mean, once you realize if those computers don't work properly, we have to send people home. The only reason we did that in the 80s was the power company shut off the power or the water to your office. Short of that, we could fix teeth. That's my superpower. I can fix teeth without computers. But today, we're dependent on it. And it seems like the standard of care requires investments in so much equipment. I mean, I know Allison has kept her practice up pretty cutting edge with huge investments. And every time you do that, you become an indentured servant to yourself. You got to pay off that investment now. And you can only pay it off with profit dollars, not the overhead dollars. So if you say, yeah, well, now I'm making $10,000 more a month. Well, that's great. What's your overhead? 65%. Okay, you got $3,500 to put towards the investment. And then you can take some home, but you got to give government tax money out of that. And you realize $10,000 in income doesn't improve my take home that much. That's daunting. And if you feel you have to do it, that's what I worry about is all this overhead going up. And then something like COVID comes along and you're sitting on a office that you paid all this money for. It's full of equipment. You're paying the staff to keep it running. And the income drops. And the first thing you do is cut your salary. And then the next thing is who else is on the chopping block? And that's hard. You got to be prepared to do that. But I think most dentists graduating today are going to be employees for at least half their career.
Mm.
Some will just say, that's what I want.
Half their career?
Oh,
Like
yeah.
20 years?
Yeah, I think so.
Wow.
Well, you said it took 20 years to pay off your student loans.
It did take 20 years.
I paid them off in 10. I'm 20 years older than you. So there are students graduating now that are 20 years younger than you and think they may have to pay student loan payments every month until they retire. And you add that to the fact that the entry costs to start up a new dental practice are
Exorbitant. Yeah.
Yeah, I mean, you would have to be able to produce a lot every month in order to break even and even more to thrive. So not everyone can do that. And I think, if you don't have the sense that you can pull this off, and it has gotten more complex, more challenging, there's a comfort in saying we're going to do this as a group. And that may be a handful of doctors working together, or you may join a multi-state network that has all these offices. And, you have to accept less income at that point because you're not the captain of the ship anymore, but you do play a critical role, a role that you should be well paid for, but it'll never be as much as if you were also the general manager and the investor.
Okay, so there's something, this can be the last one if you're thinking time-wise, but like there's something Dr. House and I have talked about when it comes to the tension of healthcare providers caring, because if you care too much, you leave yourself very open to being very discouraged when outcomes aren't pleasant or people misunderstand outcomes, however you want to phrase it. And in other medical professions, if people are dying, at some point you have to be like, I need to be very professional. So I almost have to like create some sort of separation from these tragic outcomes. I see you as someone that has found a way to still have such a tenderness where you really care and you're still somehow open to the response that a patient would have. I don't know how you've done it. It seems to me kind of miraculous that meaning at some point, like you probably had that, okay, this patient wasn't happy. I'm feeling it. I'm aware that they weren't happy. And that could either throw your week into a tailspin.
Oh, it does. I think human nature is you work all week. Let's say you saw 60 patients, 59 left happy. One complained about this or that. And who do you think about that weekend? I think that's part of our humanity. But you have to consciously rebalance your thinking and say, hey, the other 59 were pretty happy. The business is doing well. The quality of care is good. You know, it's okay to bat 950. You just take it in stride. And that was the hardest thing. I told you, personnel issues were always a challenge for me. And it seemed like I was constantly rebuilding the team. And it wasn't that often, but when you only have 4 or 5 employees, one leaves, you're in a disorganized state for a while. And I hated that. So I really valued the longevity. But, that's disruptive. It's hard to move past it. But after a while, you go, okay, that's the nature of the beast. It was very hard for me to stick a needle in a human being the first time, and over time, I've supplanted that natural reluctance with the idea is, this is how I can help Sean. I'm going to start by administering this so he can be completely pain-free during this. And I know it's going to pinch. He knows it's going to pinch. We're all okay with the pinch. It's over with. Move on. So we communicate that so no one's surprised at what's happening. But, with employees, people will quit. They will move on. Your favorite employee may tell you, my husband just took a job in Portland. And what are you going to do? Throw a party for her. Good for you. I'm glad your family's doing well. I had one employee leave one time and we did throw a party for her. And she was going to go to nursing school. We were happy for her. And I gave her a book and I wrote on it. I said, I'm sure you're going to be a great nurse. And if I ever find myself in your care, I will be comfortable and confident that I'm in good hands. And, years later, she became a nurse and told me how that meant a lot to her.
So as we wrap up, I would love to know, what is it that you want young dentists to know?
You have an opportunity to truly impact people's lives. And it's more than just the words we say. I mean, we're not talking about this like, wouldn't it be great if sales got up to here? No, you're going to feel this one. When you can help people gain back what they've lost and prevent situations where they're at risk of losing their oral health, it's a gift. It's a great way to live your life. And that, if you have that balance where you feel you're well rewarded financially, spiritually, and professionally, and anyone who looks at your work would say, Dr. House is a great dentist. And, she has enough money to retire with dignity, I hope. I'm sure she does. And, spiritually, if someone tells you might be on the way out, are you going to look back at all the care you gave people and go, I wasn't fair with that person, or I didn't do the right thing, or I did it for the wrong reasons. I was looking at my financial needs instead of their health needs. You're not going to be as satisfied. But if you reach that moment and you're sitting on the edge going, okay, I did a good job while I was here. I guess the party's over. I can shuffle off with a certain amount of pride and dignity.
Thank you for listening to the Authentic Dentist Podcast. To join Allison and Sean on this journey, hit the subscribe button to never miss an episode. Here's to your success. Express yourself fully. Live authentic.